So we are going to do this thing two ways. First thing, we are going to test. So you are going to do this test on your own. Then you do the procedure. Then you test it again, what really happened. So it is simple. So what you will do, you put your hand on your chest like this. Now you are going to turn to any side, does not matter left or right. Try to turn to any side, the whole body. Okay, come back to midline. Don't turn your head. This is what you will try to do. So actually we are not looking to turn your head. We are trying to rotate your trunk, or this is the portion we want to rotate. Now you rotate to the other side. Come back. Does any side feel tight?
My left side.
Okay. So for her, it left side feels tight. So you find which one is your tighter side and you remember that. So for her, the left side is tighter. So that we're going to remember. Now you put your arm down. Now you try to lift your arm up, but one at a time, and all the way up. And make sure this is touching your ear. The inner side of your arm is touching your ear. Keep your head straight and try to pull it back as much as you can, like that. Now you bring it down. Now you do the other side, as much as you can. Now which side feels tighter?
My left side.
Left side feels tighter. Okay, drop it. Okay. Now the left side arm feels tighter, and when she moves towards the left side, that is also tighter. Now you are going to choose this one first. So you put it back here, put it back here. Now on the left side feels tighter. So we are going to go to the opposite side, that is your right side. So what she is going to do, she is going to repeat this motion 20 times at a time. So you go ahead and rotate this way. 1, 2, 3, and every time you rotate, try to push it a little bit further on that side. Rotate, push, 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 more. So you do 20 sets at one time, keep doing it. 20 sets at one time. So you can do 20, 40, 60 times, and it is simple, and this should not be painful. It might feel a bit tight and uncomfortable, but it should not be causing any pain. And again, while sitting there, you can do some more, do some more, do some more, keep doing it. Okay, do more, push it a little bit more. Very good. Yeah, it might sound crazy and it might feel weird. I don't have time to explain all this thing. So if you are having any further problem, of course you can call here, come here, we can treat you. But this is one self-treatment which is really, really helpful. Okay, now you stop. Now she stopped. So if we did something, so something must have changed. So we are going to test it back again if something changed. So put it here, put it back here again. Now you go to that side. So it will loose or tight?
It's a lot looser.
A lot looser. So even if it's a lot looser, it is not perfect. So she is going to do the same repetition again, maybe 20 or 40 times, again to the loose side, not the tight side, to the loose side. And it is going to change again. Now we are going to test this one. Okay, lift your arm again. Does it feel tight or loose?
Looser.
It is looser, but still we are going to treat that. So how we are going to do? This is her loose side and this is her tight side, the left side. So the right arm, she is going to repeat this motion again, 20 to 40 times to 60 times. Go lift your arm up, push back, 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 back. Very good, bring it back. Do it again. And do that 20, 30, 40 times. Do as many as you want. Keep doing it. Again, this should not be painful. I can repeat you. And if you have some numbness in your arm, that's okay, you can do it. By doing this, you cannot hurt yourself. The worst thing is going to happen is nothing. But it is extremely helpful. Okay, very good. Now try this. Loose? Much looser.
Yeah.
Okay. So these are the two things you are doing. You have to do some repetition, be patient, and keep repeating it. So you will find yourself, your shoulder pain has reduced tremendously, but this is not the real treatment. The problem is still there, but temporarily it can relieve a lot of your pain. It is much better than popping Tylenol or any kind of pain medication or having injection or surgery. We are here to help. Thank you for watching.